Hello, hello.
Hey, what's up, Andy?
How are you?
I'm good.
So, are you ready for your 73 questions on this beautiful day?
Let's do it, man.
So, let's get started. What is your name?
My name is Bryan.
And what is your specialty?
I do Pediatric Orthopedic Surgery.
How many years have you been practicing?
2.
So, where are you originally from?
From a place called Decula, Georgia, just east of Atlanta in Gwinnett County.
Where'd you go to undergrad?
I did undergrad at Valdosta State University. Go Blazers.
And med school?
I went to med school here at the Medical College of Georgia.
Nice. I guess I'm in the right place. So, did you take any gap years before coming to med school?
I did not. I was a traditional student, but some of the more interesting people that I've met did take gap years.
What was your favorite part of medical school?
I think my favorite part was kind of forming the relationships with the people I went through it with.
Ooh. So what specialty did you think you were going to go into on your first day of med school?
It's kind of cheesy. I think I had in mind that I was probably going to do ortho.
Huh. Okay. Well, that kind of answers my next question, because usually I ask, what changed your mind? But not many physicians come into med school coming out with the same specialty in mind.
Yeah, I think I kind of had it in mind from the get-go just because, next to like the pediatrician or primary care family doc that I went to for cough and colds and stuff, I spent probably just as much time in an orthopedics office with, various injuries or whatever, with sports and whatnot.
So were there any specialties you immediately said, absolutely not for me?
Yeah, I'm embarrassed to say this, but actually ophthalmology or anything to do with the eyes is not for me, just because this is crazy. I have very sensitive eyes. If you even talk to me about, getting something stuck in your eye or trying to, put contacts in or anything, I can't do it. I got to stop talking about it now. My eyes will start watering. The eyes are beautifully created organ, but just not for me.
Well, orthopedic surgery is one of the most popular specialties out there. So what was the moment you realized that that was what you wanted to do?
I think the moment when I rotated through as a med student, that really solidified it for me. I think I really got to see the impact more so than I ever have just kind of standing from the outside looking in.
So how long does your training take after med school?
So orthopedics in general is a 5-year residency, and all of our subspecialty fellowships are 1 year. So I did 5 years of a general orthopedic surgery residency, and then I did 1 fellowship year doing just pediatric orthopedics.
So why do you think orthopedic surgery is so competitive nowadays?
I don't know. I think people, look at orthopedic surgeons like they may be like making a bunch of money and dealing with all these professional athletes, which is really not true. I guess it could be, but for me, it's not. I think people want to go into ortho because I think for the most part, orthopedic surgeons, if you're around them, I think they really enjoy what they're doing. And I think that speaks volumes, and people see that.
Okay. So why subspecialize into pediatrics?
I think that, when I was rotating through on peds, on the peds subspecialty service, I think I got to see, I really, for the first time ever, I got to see the resilience of a kid and the resilience of a family, for that matter. When they had kids with, these lifelong, pathologies of like, neuromuscular conditions and whatnot, to see them with that being dealt that hand in life, but still being so resilient, was a very powerful thing, and one that I think led me to what I'm doing.
So what would you say is the most unique part of your specialty?
The most unique thing, part of what I do, I think, is probably the variability of it all. I think, I could do like scoliosis spine surgery one day, and maybe have to like pin an elbow on call that night, or come in and take someone's ingrown toenails off. Or, it's just such a huge variability. I mean, we're operating on anything in the extremities.
So, all right, salesman cap on now.
Okay.
Why should someone choose your specialty?
I think if people see the value in children and taking care of a kid, and if someone likes to problem solve and try to kind of restore a kid's livelihood, I think that's what would drive them to do peds orthopedics.
All right, turn it around, devil's advocate. Why should someone not choose your specialty?
Well, I hear all the time that people don't want to do a lot of peds specialties because they don't want to deal with parents or something like that. And I think it can be challenging sometimes, but if people can't, I'll preface this with saying that I think being a parent is a very vulnerable thing, and facing that vulnerability and trying to be an advocate for someone while they're that vulnerable, seeing their kid go through something. I think if you can't sympathize with that, then you probably shouldn't do it.
So, little fun question.
All right.
Are there any stereotypes about your specialty?
Yes, there are. I think most people think of orthopedic surgeons as like these big, buff meatheads, but obviously I broke the mold. So, yeah.
Oh, next question is, are they true? But I guess not.
You might still be able to find some meatheads out there.
So, what do you do in an average day?
So it depends. Usually I have throughout the week I'll have like a dedicated operating room day where I'm doing surgeries all day, or I try to fill it up to do them all day. And then other days I might have like a full clinic day. And sometimes they're split half and half, so I might have clinic in the morning and OR in the afternoon.
Okay. What is your favorite procedure to do?
I like doing spine deformity surgery, scoliosis surgery. I really like that. I think not only can you prevent kids from having really terrible deformities later in life, but I think in treating them in their childhood and adolescence, I think you can improve their body image and help their self-esteem maybe, especially if people are they have a very big spine deformity. I think that can weigh on them a little bit. So, yeah.
Okay. So what's the craziest procedure you've ever had to do?
Probably the more crazier things in peds ortho is some of the tumor docs will do like a Van Ness procedure, and it sounds very grotesque, but they actually sometimes in tumor surgery you have to take a tumor out and you're left with a big void in the limb. So sometimes what they'll do is they'll take the foot and ankle and the lower leg, they'll flip it around 180, and then they'll kind of tie it back into the femur and take away somebody's actual knee. But when they turn around backwards, that backwards ankle actually functions like their knee, and they can do surprisingly well. So, but that's kind of a crazy procedure.
That's awesome. So how often do you work with medical students?
Regularly. We usually have several rotate through on the service any given point in time. So,
what's the craziest question you've asked a resident, either both serious or jokingly?
Usually I just ask them questions about anatomy, but usually I'll get them on whatever music's playing in the background, ask them who sings it or who plays it.
How many patients do you see on an average day?
On an average day, full clinic day, I probably see about 30 patients.
Okay. How many hours do you work in an average week?
About 50 or 60.
So I love asking these questions because it varies with every specialty. What time do you normally wake up?
What time my alarm goes off versus what time I wake up? About 5:30, between 5:30 and 6.
Okay. How many hours of sleep are you typically working on?
About 6.
How many hours of sleep are you working on right now?
Well, probably about 4 right now, but I have a newborn at home, so things they're not quite normal right now.
Understandable. What time do you normally leave the hospital?
Normally I'll leave the hospital between 3 and 5 every day.
So do you have to take call at all?
I do. We have 5 providers in our staff that'll take peds ortho calls, so like 1 in 5 weekdays and 1 in 5 weekends I'll take peds ortho call.
Yeah. Are you a night owl or morning person?
Neither. Probably somewhere in between.
How long does it take for you to finish your patient notes at the end of the day?
Not too long. I generally try to do them as I go, so probably about 30 minutes, maybe an hour some days.
Okay. So, who are you most thankful for on your care team?
It's hard to single somebody out. If I had to, I would probably choose our nurse, who's now becoming our nurse practitioner. But she handles all the indescribable things that go into patient care, the phone calls, the logistics, all the things that just magically get done, and she helps do. So along with other members of our care team, but she does a lot.
Perfect. What is the most rewarding part of your field?
High-fiving a kid when they come back after healing up a fracture or something and seeing the smile on their face.
Oh, that's awesome.
Yep.
So what is the most common medical advice you give to your patients?
Probably not to get a cast wet.
Yeah. So again, a little bit more peds oriented. Are you ever afraid of talking to parents?
Not really afraid. I think sometimes I'm more nervous or anxious about it just because there can be some difficult conversations to be had. Like I said, having a kid go through something that's very vulnerable, and sometimes you're having to take a pretty deep breath before you go into a room to talk with somebody, just because there's a lot of emotions involved. So it can be challenging, but so yeah, I guess in a way, yeah, every once in a while.
All right. So what is the funniest thing you've seen in a patient chart without violating HIPAA?
This sounds terrible. When I was training, my intern year, I helped take care of a guy who got stabbed in the heart with a dinner knife by a family member over a piece of chicken at the dinner table. So it's that's terribly morbid, but
Must have been a good piece of chicken.
yeah, I think he turned out okay though.
Perfect. Good to hear.
Yeah.
All right, so we've talked a lot about your life inside the hospital. So how about your life when you clock out? So what is your favorite thing to do when you're not working?
I enjoy coming home to my wife and 3 kids. Yeah, that's what I like to do.
Oh, guess that answers the next question. You have a significant other or any kids?
Yes, I have a wonderful wife, and I have twin, almost 5-year-olds, and I have a newborn. So,
Congratulations.
yes, thank you.
So does your family ever ask you for random medical advice?
Oh, yes, yes. Usually I don't have a lot to offer, but it's generally like some sort of rash or, something about a sore knee or sore elbow and want me to come up with something that, to label it as. But yeah, it's bound to happen.
What's the craziest question you've been asked by a family member then?
I don't know, they're generally not too crazy. Probably, I don't know, probably something about some rash that came up on their hand. Nothing too extravagant, but just makes me wonder what they were doing to get a rash like that.
Oh, any pets?
No pets.
Dog or cat person?
Dog person if I have to choose.
Favorite animal not a dog or cat?
I think there are few animals as powerful and as soulful as a horse, so I will say a horse.
Okay.
Yeah.
I think we got a little bit of traffic behind us.
Man. Look at that.
We'll let him pass. Hello.
How are you doing? That's all right. Have a good day. Oh, they're stopping right here. Let's keep going. Well, hey, let's go back the other way. That way you won't catch up.
Little intermission.
Yeah, that's all right.
So, if you could have dinner with anyone in history, who would it be?
Probably my grandfather. I think now that I'm a little bit more of an adult, I would like to have a talk with him. That'd be nice.
So, what would you guys be eating at that dinner?
It's kind of nostalgic. Probably scrambled eggs. They used to take care of me in the summertime when my parents worked, and they always, or he used to specifically cook scrambled eggs, so we'd probably have scrambled eggs.
Okay. What's your favorite dish to eat?
I like Asian food, so that's usually if you say that, I'm all in.
And coffee, tea, or soda?
Coffee.
How much water should you be drinking every day?
A lot more than I drink. Bunches.
Do you have a favorite meal from the hospital cafeteria?
I do actually, yes. So I've been here for med school, residency, and now as an attending. So I enjoy going on Thursday afternoons and getting a vegetable plate. They have good vegetables on Thursdays.
Okay. I will keep that one in mind when I hit rotations. What is your favorite guilty snack or cheat meal?
I can always do a cheeseburger.
All right. And controversial one, pineapple on pizza, yes or no?
So yeah, you can do pineapple on pizza. I think Marco's has a great chicken Hawaiian. They got chicken, bacon, pineapple. It's perfect.
All right. Apple or Android?
Apple.
Any artistic hobbies you keep up with?
Not as much as I used to, but I enjoy playing music.
What kind of music do you listen to in the OR?
Anything, man. Depends on the mood. Anything from, Otis Redding to Temple of the Dog, man.
So, what is the best way that you relax after a long day?
So I'll say when we're putting our kids down to bed and I'm laying at the foot of the bed, that's like the most relaxing thing for me, and it's really easy to go to sleep. So yeah, that's probably what I like to do.
Night in or go out on the town kind of person?
I'm kind of a homebody. I'd say night in.
Indoors or outdoors?
I do like getting out, as long as my allergies don't make me sneeze all the time.
Beach or mountains?
If it's for a day at the beach, if it's for a retirement, the mountains.
Would you consider yourself more of an introvert or extrovert?
Introvert. Unless you're in my inner circle, and I might be a little bit more extroverted.
Would you say that personality trait was a factor in you choosing your specialty?
I don't think so. I think there's room for both kinds of people.
Alrighty. Well, thank you so much for your time. We're getting close to the end.
Okay.
So, near the end, I'd like to ask some more reflective questions.
Okay, well, let's go sit down over here.
Sure.
We'll grab a seat. You've been walking backwards for a little while.
I'm just getting my steps in for the day.
All right, man.
Oh.
All right, shady spot here.
Oh, love it.
All right, man.
All right, you ready
Fire
for the
away.
deep questions?
Yep, fire away.
So, what did you think you were going to be when you grew up as a kid?
As a kid, probably gonna be a cowboy.
Awesome.
Yeah.
Is there a different specialty you think you could have done?
Yeah, I think I could have done a lot of different things. I don't know if I'd be as happy as I am now, but I could have done a lot of things for a living.
So, adding on to that, if you didn't do medicine, what do you think you'd be doing right now?
Man, I really don't know. Probably some sort of like skilled labor position, like a electrician or a carpenter or a welder or something like that.
All right.
I don't know.
So, I know anybody watching this as a pre-med or current medical student, I can say for myself, the medical route is hard.
Yeah.
So, were there any times throughout the process that you doubted that you would make it as a doctor?
There were certainly tough times, but none of which I felt that discouraged to doubt myself. I always thought things would, there'd be a light at the end of the tunnel. So.
Great outlook on it.
Yeah.
If you could change one thing about the medical field right now, what would it be?
If I could change one thing, it would probably be to incorporate emotional intelligence into the curriculum and just into make people start thinking about that a lot earlier. And even before, probably that transitions beyond medicine too. But and I'm speaking from personal experience on that. It's something I wish I would have looked into a lot earlier.
Very well said.
Yeah.
So, what can a medical student do right now to prepare to go into your specialty?
Just study hard and do good on the steps and the boards, and don't let that be the thing that holds you back.
If you were to go back, would you change any of your experiences that got you to where you are right now?
That's a good question. No. I think one of my wise professors once said that calm seas never made a good sailor. So I think everybody can look back and see hardships or, you know, failures to some degree and want to change that. But that's kind of, that tough stuff is what makes you who you are, builds the character. So I'll keep it.
Very well said again. Finally, we are at the last question.
Oh man, all right, fire away.
Number 73. Mr. Speedboat over there is being really loud, doesn't want us to finish.
That's all right, man.
But what would you say to the aspiring pediatric orthopedic surgeon right now?
I'd say to, find what, really focus in and hold dear what gives you passion in life and what gives you purpose. And through whatever hardship that will come, and you know, the tough situations that, you know, berate you as you go through, you know, learning how to do medicine and practice medicine. I think if you hold on to that kind of stuff, so you can, you know, really just have it there to recall quickly and think about it quite often, you know, I think, you know, it'll help you tremendously. So that's what I would say.
Well, thank you so much, Dr. Bryan. That is
Yeah,
all
man.
I have for you.
All right, that was great.